Here we're talking about the risk of the pregnancy itself, but there are other gender-specific issues in epilepsy. And one of those is not getting pregnant. Some of the old drugs that have enzyme induction will interfere with the birth control pills and make a woman more likely to get pregnant. So this is important to understand that when you're taking one of those drugs or prescribing it. In addition, there's a catamenial epilepsy. This occurs at certain times during the menstrual cycle, and there's a shift in the major hormones, estrogen and progesterone, that put women at a little bit higher risk. Their seizure threshold becomes lower and more chances to have seizures. So this presents a challenge in control for some women. Another one that's not absolutely gender specific, but does affect women more than men, is bone density, because women have a higher risk to osteoporosis after they go through menopause. And if you start before you get to menopause with low bone density, then your risk is much higher in that regard. So we pay a lot of attention to this, especially for drugs that interfere with bone density. But in one study that we did some years ago, we found that vitamin D deficiency was present in about half of patients with epilepsy. And this was true even for the drugs that don't interfere with vitamin D, like the old enzyme inducers. So it's something I check routinely. And if they're vitamin D deficient, then I would check their bone density to make sure we don't need to do other therapies to build those bones back up. So that's another important factor that we see in women. One thing I didn't mention that's a gender specific, but it's related to pregnancy, but not to the children's outcome, is that for a lot of these medicines like lamotrigine and levetiracetam, there's a marked change in clearance, but it's quite variable across women. Overall, it's about 200%, but it's quite variable. And this can lower the levels and make the women more susceptible to seizures. In the United States, our approach at tertiary centers is to check the levels monthly and adjust the levels to try to keep them where they were pre-pregnancy. The good news is if a woman is seizure-free for 9 months before she goes into the pregnancy, then she has about a 90% chance of staying seizure-free during the pregnancy, especially if you adjust those levels like that.